So how do you decide what's best for you? Medical cost sharing is not the best solution for everyone, but it is the superior solution for most. Let's look at some pros and cons for medical cost sharing. First, a pro, cost of acquisition. Membership in a cost-sharing community can be as much as 50% less than insurance premiums when compared to the market price of family coverage. Even when compared to group insurance coverage obtained through an employer, the monthly cost is always significantly less, with the possible exception of a large self-insured corporation. How about cost of utilization? This is the area where medical cost sharing excels compared to insurance and represents the primary savings associated with medical cost sharing. As previously stated, medical cost sharing is structured in a way more consistent with how members utilize medical services. In other words, the member's share of any major medical expense is paid only when the event occurs, and the amount is much smaller than insurance deductibles. Sedera has nothing comparable to either coinsurance or copays. When a medical need occurs, the member is responsible for payment of the initial uninsurable amount, and all remaining eligible expenses are shared with the community. Sedera has nothing comparable to the out-of-pocket maximum of an insurance policy, but it's possible to make some projections that would indicate what the financial exposure would be for a health share member. When a medical need occurs, the initial uninsurable amount would constitute the bulk of out-of-pocket expenses. Since the IUA is limited to 3 per year per family, multiplying the member's IUA times 3 would establish a good basis for an out-of-pocket maximum. For example, if a member has a $1,500 IUA membership and has 3 major medical events in 1 year, which is statistically unlikely, their out-of-pocket is still only $4,500 compared to the $5,000 or $6,000 insurance deductible. Additional out-of-pocket expenses during any given year would be comprised of cash pay services provided by medical specialists. Remember, your basic primary care services are included in your virtual services, so the only time you'd pay for primary care services is when you go to a specialist or go out for imaging services, etc. Imaging centers are laboratory service providers, the combined cost of which do not reach the level of a need. In other words, if a member accumulates cash-paid medical expenses for a given medical condition that do not reach the level of their IUA, those expenses would be the responsibility of the member. When comparing out-of-pocket maximums, you must factor in that the insurance deductibles start over again every year. But when an initial uninsurable amount is paid on a given need, treatment can be continued into subsequent years with no additional IUA payment. Considering insurance deductibles for a silver plan are between $5,000 and $6,000, this can be a huge savings, to say nothing of the fact that having 3 needs per year is highly improbable. In-network and out-of-network insurance companies negotiate preferred pricing with certain medical service providers, so they offer better coverage when the policyholder uses their providers. It's not uncommon to find that cash pay rates offered by service providers are lower than the insurance company's negotiated rates. Sedera has no provider network. Members can select preferred providers anywhere they want. Sedera's only concern is that the provider is offering reasonable cash prices for their services, and Sedera will take a hands-on role in working with the provider to assure fair pricing. Price transparency is another pro. Price transparency is almost impossible for insurance companies because there are so many variables. Here are a few examples. As the treatment for a major medical condition progresses, services will be included that weren't anticipated in the beginning, and the policy may require a copayment on some of those services. Sedera doesn't have copayments. They cover the entire cost of the services. Another is that an in-network major medical treatment center can quote a price for a medical procedure, but if a doctor performing the procedure that does not, coming into that center to perform the procedure does not have a negotiated rate with the insurance company, the patient will be charged for out-of-network pricing for the doctor's services. Sedera doesn't have provider networks. In the last example, medical service providers use what they call CPT codes to identify the various treatments they deliver for a given condition, and hospitals use ICD codes. We can talk about those at another time, but these codes not only record the condition being treated, but also the level of treatment delivered during that patient interaction. For instance, a 5-digit CPT code like 12345 might be followed by 2 more digits like 01, which means the doctor merely observed the condition. If the code was followed with an 02, it might mean the doctor spent time taking steps to examine the condition in more detail. And a code 03 might mean the doctor went as far as treating the condition. When claims are submitted to insurance providers, these codes determine the amount of payment to the provider. So a frequent practice is to upcode, what they call upcode these services, which causes the insurance company to overpay the provider based on the treatment level delivered. It's very difficult for the insurance company to identify upcoding, and there are reasons why they are not overly concerned about regulating upcoding. I'll discuss this in more detail in future episodes when we discuss the ways in which insurance companies can manage their profitability. How about annual price increases? The last pro we'll touch on is annual price increases, which the insurance industry is diligent in providing. Healthcare companies only increase their contribution rate in response to actual increases in the cost of medical services. And there's no maximum sharing limit with a cost share community. Well, I shouldn't say that. With Sedera's cost share community, there's no maximum limits. Some communities do have maximum limits. Some healthcare communities establish max limits on periodic or lifetime sharing. Sedera has established no such limits.